Brain tumors in children are abnormal growths of cells in or around the brain. These tumors can be benign, non-cancerous, or malignant, cancerous, and vary widely in their growth rate and impact. Brain tumors are among the most common solid tumors in children and can significantly affect the child's health due to the brain's critical role in controlling bodily functions. Types of brain tumors in children. 1. Gliomas. Tumors arising from glial cells, which support and protect neurons. Examples. Astrocytomas can range from low-grade, slow-growing, to high-grade, aggressive. Ependymomas develop in the lining of the brain's ventricles or spinal cord. Brainstem gliomas, e.g., DAPG, often aggressive and located in the brainstem. 2. Medulloblastomas. The most common malignant brain tumor in children. Arises in the cerebellum, back of the brain, and can spread through the cerebrospinal fluid. 3. Craniopharyngiomas. Benign tumors near the pituitary gland, which can affect hormone production and vision. 4. Germ cell tumors. Rare tumors that develop from embryonic cells, often near the brain center. 5. Pineal region tumors. Occur in or near the pineal gland and may block cerebrospinal fluid flow, causing hydrocephalus. 6. Choroid plexus tumors. Arise in the brain's ventricles and may disrupt cerebrospinal fluid production. Causes. The exact cause of brain tumors in children is often unknown, but some factors may contribute. 1. Genetic predisposition. Inherited syndromes such as Li-Fraumeni syndrome, neurofibromatosis, or tuberous sclerosis. 2. Environmental factors. Exposure to radiation or carcinogens, though rare in children. 3. Spontaneous mutations. Random DNA changes during cell division. Symptoms. Symptoms vary depending on the tumor size, location, and growth rate. Common signs include general symptoms due to increased intracranial pressure, persistent headaches, worse in the morning or after lying down, nausea and vomiting, unrelated to illness, fatigue or drowsiness, seizures, blurred or double vision, difficulty walking or balance issues. Specific symptoms, depending on the tumor's location: cerebellum, poor coordination, difficulty with fine motor skills or balance issues. Brainstem, weakness, difficulty swallowing or speech problems. Pituitary gland or optic nerves, hormonal imbalances, growth problems, or vision loss. Frontal lobe, behavioral changes or difficulty concentrating. Temporal lobe, memory problems or speech difficulties. Diagnosis. Diagnosing brain tumors involves a combination of clinical evaluation and imaging. 1. Neurological exam. Assessing reflexes, strength, coordination, and sensory function. 2. Imaging studies. MRI, magnetic resonance imaging, the preferred method for detailed brain imaging. CT scan, computed tomography, may be used in emergencies or when MRI is unavailable. 3. Biopsy. Removing a sample of the tumor to determine its type and grade. 4. Lumbar puncture, spinal tap, to check for tumor cells in the cerebrospinal fluid, used in medulloblastomas and other tumors that may spread. 5. Molecular and genetic testing, to identify specific mutations and guide targeted treatments. Treatment. Treatment depends on the type, location, and grade of the tumor, as well as the child's overall health. Options include: 1. Surgery. The primary treatment for many brain tumors to remove as much of the tumor as safely possible. 2. Radiation therapy. Often used for malignant or residual tumors after surgery. May be avoided or delayed in very young children due to potential long-term effects. 3. Chemotherapy. Used to shrink tumors, prevent recurrence, or treat tumors that have spread. 4. Targeted therapy. Newer treatments that target specific genetic mutations or pathways in tumor cells. 5. Supportive treatments. Shunts or endoscopic procedures to relieve hydrocephalus caused by cerebrospinal fluid buildup. Rehabilitation therapy. Physical, occupational, or speech therapy to address developmental or neurological impairments. Prognosis. Prognosis varies depending on the tumor type, location, and response to treatment. Low-grade tumors, e.g., pilocytic astrocytomas, often have an excellent prognosis. High-grade tumors, e.g., medulloblastomas, brainstem gliomas, may have a poorer prognosis but are improving with advances in treatment. Complications. 1. Treatment-related complications. Cognitive or developmental delays. Hormonal imbalances, from pituitary involvement or radiation. Growth problems or secondary cancers, rare but possible with radiation therapy. 2. Neurological deficits. Persistent motor or sensory issues. Vision or hearing loss. 3. Emotional and psychological impact. Anxiety, depression, or challenges with social reintegration after treatment. Follow-up care. Regular imaging and checkups to monitor for recurrence or late effects of treatment. Rehabilitation to address developmental delays or physical impairments. Psychosocial support for the child and family to cope with the emotional burden of the illness. Support for families. Access to pediatric oncology specialists and support groups can help families navigate the challenges of managing a child with a brain tumor. Organizations like the Brain Tumor Foundation for Children or St. Jude Children's Research Hospital provide resources and assistance. Early diagnosis and advances in treatment have significantly improved outcomes for many children with brain tumors. A multidisciplinary approach is essential for the best care.